Good morning. This video is intended for folks with arthritis and specific movements that will help the hot spots with arthritis. And most common, my patients complain of problems with their knees and their lower backs. So this video is designed to be a first thing in the morning, perhaps you still are in bed and you do this routine to try to get some movement, some nourishment, some warming of the fluids of your knees and of the joints of your lower back. My name is Dr. Chad Woodard, and in conjunction with CreakyJoints, I want to bring you this video, and I also want to make sure that you know to take these exercises at your own pace and through as much range of motion as is safe for you. Please don't feel that you have to really push through motions, especially if that's causing you sharp pain or significant discomfort. If any of these exercises give you the sensation of a stretching feeling or perhaps even a slight aching feeling, oftentimes that can be okay. If you feel sharpness or stabbing, not okay. If you're unsure, please absolutely speak to your medical professional and make sure that these are safe for you. So, I'll be lying down during this video, and you can either be watching or you can just be listening, and I'll do my best to give you verbal cues so you can just listen in if watching is difficult to do at the same time. So right from a lying down position, first thing in the morning in bed, what I would like for you to do is pick one leg. I'm going to use my left leg and just straighten it out on the bed. Now your knee is as straight as it can be. Perhaps your knee doesn't get all the way straight, perhaps it stays a little bit bent. That's fine. You be wherever you are as straight as possible. Now the first exercise I want you to do is to think of straightening that left leg as straight as it'll go. You can imagine pushing the back of your knee down into the bed. You can also imagine lifting that left heel off of the bed. So you've got as straight of a knee as possible. You're really contracting your quadriceps, your thigh muscle, the front of your leg, to make this happen. Holding for 5, 4, 3, 2, 1. Good, and relax. Now, as you work up to this, you might repeat that a second or a third time, depending on your tolerance. This video, I'm just going to show it once, but as you get better and stronger, you might want to just pause this video and do that exact same thing 2 more times. Let's do the right side just once. Right leg is down, flat on the bed. Knee is going to press down into the bed. So really push the back of the knee into the bed. Think of lifting that right heel. Now, if your knee cannot get all the way down to the bed, perhaps your knee stays a bit bent. That's absolutely fine. You can put a pillow underneath your knee and push down into that pillow. Good, do your best through your range of motion, getting your knee as straight and as locked out as it possibly can be. Holding for 5, squeeze your quad, 4, 3, lift the heel, 2, and 1. Beautiful. So same thing, you might want to pause this and do that a couple of times on each side. Next, you're just going to give yourself a hug. It's morning time, you deserve a hug. So I want you to, as best as you can, watch this first. The idea is you're going to bring your knees into your chest, and you're imagining that you're going to be able to bring them in enough that you can actually wrap your hands around and hold on to the opposite elbows of each arm. Now that's a pretty significant range of motion, and if you cannot get that far, that's totally fine. You go as far as you can. So lying flat down, just bring both knees into chest. Now a couple of modifications. You can hold here at your shins and give a little bit of a pull into your chest. If that's too aggressive on your knees, what I would have you do is, instead of holding your shins, hold the backs of your thighs, and then you're going to gently pull on your legs by pulling through the backs of your thighs, whichever feels good to you. So let's go ahead and meet here in this position, holding either the shins or the backs of the thighs. Your head is relaxed down onto the bed. And now with your arm strength, I want you to just give a gentle pull. Now if you're okay there, just hold, and I'm going to talk through a couple of things. If that's too intense, pull less, so a little bit less intense. If you can, every time you exhale, you're going to pull in just a little bit more. So inhale and exhale, maybe pull a little bit more if you feel you can. Now we're going to hold this position for a little while. If you need breaks, take a break. That's absolutely fine. I'm just going to talk through a few things as we're holding this position, but you hold to your tolerance. The nice thing about this exercise is we're getting both movement and nutrition through your knee joints as well as some of your lumbar spine joints. If you can see, as I pull further and further, my lower back actually starts to peel itself off of my yoga mat. So I'm inducing very gentle, small range of motion flexion of my lumbar spine. So just keep holding that. Now together, wherever you are, if you have to take a break and you can rejoin us. Go ahead and hold those legs. We're going to do 3 breaths here. Inhale. Exhale. Good. Pull maybe a little more if you can. Drop your shoulders. Again, inhale. Exhale. Pull a bit more if you've got it. Drop shoulders. Perhaps you have a smile on your face. Inhale. Perhaps you don't. Exhale. Last one. Good. Very good. Now you can do shorter bouts of that exercise if holding as long as I just did is a little too much for you. Just come in and out of it, just a nice hug. One more exercise we're going to do on both sides. So I'm going to straighten out one leg. I have my left leg straightened. My right leg is going to lift and come up over and across. Now I'm twisting my lower body and I'm getting a gentle twist throughout my lumbar spine. It's like I'm wringing out a towel. Now you go to your range of motion. If it's too intense to get your knee down to the bed, put a pillow and rest your knee on the pillow, whatever you need to do. If you can, with that leg dropped off to the side, now you can rotate through your head and neck and really twist yourself from bottom to top. If that's too intense, don't add in the head portion. Now just take a few breaths here for me. And perhaps on the exhale, your knee gets a little closer to the bed. Perhaps your head rotates a little bit further. And you can do whatever feels appropriate and comfortable with your arms. I have my arms braced on my low back and on my leg, just because that feels comfortable to me. You find where they feel good to you. One more breath. And exhale. Good, let's do the opposite side. So now my right leg is straight on the bed. My left leg comes across as far as it can for you. I have a couch in the way, but you go as far as you can. So you've just got that leg dropped over, and if you can, you're gonna twist. Beautiful. Now, same thing, you just hold as deep of a range of motion as you safely can without any sharp pains. If this is causing sharp pains in your back or in your hip, I want you just to back off of that range of motion, a little bit less intense. Good. Take a couple of deep breaths here. Exhale. See if you can just allow a little bit more range of motion, a little more twist in your lumbar spine. Inhale one more time. And exhale. Beautiful job. We can untangle ourselves. Fantastic. So that's a specific morning routine, really to address just starting to get those knees and the lumbar spine warmed up and moving. Please go at your own pace. If that felt good, then you can just rewind, do the whole thing over again. But I don't want you to overdo these exercises, but they're designed to be modifiable and less aggressive enough that you should be able to do them again should you choose. Thank you for tuning in. Again, my name is Dr. Chad Woodard. If you have specific questions for me, you can certainly reach out and find me on all the social media platforms at Ask Dr. Chad. In conjunction with CreakyJoints, whom I love, thank you for tuning in and watching this. I hope that you found it valuable. I hope it gets your day started a bit better, gets those knees and that back cooking and ready to go for a day. Thank you, be well, and keep moving.